Okay. Pursuant to Governor Baker's March 12, 2020 order suspending certain provisions of the open meeting law, General Law, Chapter 30A, Section 18, and the Governor's March 23, 2020 order imposing strict limitations on the number of people that may gather in one place. This meeting in West Newbury Board of Health is conducted by remote participation and its greatest extent possible. Specific information and granted, I think it's and the general guidelines for remote participation by members of the public and or parties with a right and or requirement to attend this meeting can be found in the Town of West Newbury's website, www.westnewbury.org or www.newbury.org. For this meeting, members of the public who wish to listen to the meeting may do so by the following number. Go to meeting, United States, 1-312-757-3121. One touch telephone is 1-275-731-31. 532549133 hashtag. Area code, access code, sorry, 532-549-133, or from computer, tablet, and smartphone, http://gotomeeting.com, join 5325-49133. No in-person attendance of the meetings in public will be permitted, but every effort will be made to ensure that the public can adequately access the proceedings in real time by technological means. In the event that we are unable to do so, despite best efforts, we will post on the town website an audio and video recording, transcript, or other comprehensive record proceedings of the Zoom and participants. As soon as practical after the meeting. Hope everybody got that because it's good. All right. Now we can try these minutes. Which I don't have seen have copies.
They were in the package.
Yay. I think I probably put that on.
I think I got an update from you. Actually, you left them like that.
No. Hey, Steve Lantern.
Yeah, sent you guys the last monitoring for the gas vents. It seems like the trench is working. And then I think, Bob, you just signed a proposal for groundwater monitoring, biannual round of that. And we're waiting for the engineer to do the final as-built plan and submit the post-construction report to DEP. So far the landfill is going well. I think that's about all we have to say on that.
Okay. COVID-19 update.
So as you know, I think the reason why everyone else is on the call was last week I had a conference call with the West Newbury Youth League director and various sports directors. We had a conference call. Basically, we discussed the numbers, and I recommended that the sports be allowed to resume play. They were on a 2 to 3 week hiatus because of some positive numbers in the school district. They shut down proactively after a couple weeks, and then we recommended another week shutdown so we can discuss it. We discussed it last week. At that time, we also discussed some complaints that I received, and as of the conference call, it appears that the Western Youth League also received some complaints about some individuals, players not wearing facial coverings, so we discussed that. And I was unaware of it until a couple weeks ago when I received some complaints myself. I researched it, looked into the state, got some more state guidance on it. And then Friday night, I basically made an order that anyone playing in the Western Youth League needed to wear a facial covering while playing or on the bench. And if they cannot wear a facial covering, then they needed to take a mask break outside away from individuals to maintain, safe distance. So my understanding was the youth league was on board with that. They submitted that out to, I guess, one family who appeared to have some medical concerns, an exemption, and that kind of sparked some interest. So at this point, it's up to the board to decide on my order, whether it should be upheld, modified, or, revoked and dismissed. So obviously you guys have seen all the email correspondence between myself and the youth league, as well as between that family and the Board of Health. I know some of you may have already talked to town council as to what Board of Health can and cannot do. You saw the response that I got from the state, my contact there regards to the youth sports. So I did that Friday, so the youth sports could send out a message to all the athletes that, play could resume, but with certain stipulations. And that was on Friday, and now here we are Tuesday having this discussion. So again, I'll leave it up to you guys to decide which way you go on it. You know my order, what it said, what it was meant for, and then whatever you guys decide, I'm good with. So I'll leave it up to you for discussion. And then if you want, we can ask the callers on the line, which is, Jack Foley, the director of West Newbury Youth League, as well as one of the coaches of the, I think, flag football, I believe. So anyways, I'll leave it up to you, Bob, and you guys can discuss it.
Okay. No kid family safe. I'd like to hear from sports people, their concerns.
Jack or anyone want to comment regards to the facial covering order?
I'm sorry, Paul, I didn't hear the question.
Yeah, Bob, I wanted to, give you guys the chance, you and Hathaway, to comment on the facial covering order that I put out there on Friday before the board made a determination as to whether they should modify, rescind, or uphold the order. I just wanted to hear your thoughts, your opinion. So if you have no opinion, that's good too. Just, Bob just wanted to reach out to you guys to see if you had any thoughts.
Okay, I understand. The microphone is, but you're much clearer on the microphone, Paul, than Bob was. So regarding the October 16th Board of, what I understand to be a Board of Health order, essentially a no mask, no play order, we did communicate that to the family, as was communicated to us from Board of Health, from the health agent. Which is what started the email thread regarding the potential challenges to that order. So the Youth League doesn't have an opinion on the order. We want to be consistent and to incorporate state and local guidance, which has been our philosophy on this all along. So whatever that state guidance is with local amendments, that's what we will That's what we will use as our guide.
All
I
right.
have, Youth League has no opinion on the order itself and how the order pertains to the state guidance and the other questions that have been raised.
All right, thanks, Jack. Hathaway, any comment or you good?
I'm good with that as well.
All right, just want to make sure you were involved. All right, I guess it's up to you three. If you guys,
Before we go on to,
you can just make sure you speak loud because you guys got, this microphone here is going to pick you up.
before we go on to either second, rescind, whatever, your order, something seems a little different to me. Only one of the parents of the whole youth league, this order was given to. What part am I missing? I'm addressing this maybe to Jack or who else is on there. Why was it only sent to the one family, not to the entire youth league players?
Blake, this is Jack. It's the Youth League's understanding. There's one family that has these medical exemptions, and that's the family in focus. There is no other family that I'm aware of that has medical exemptions that would be challenging a no mask, no play policy.
Okay, well, the only problem I have, and it's not a problem, I'm just speaking my word. After looking at it, I believe their last name is Moshes, emails, it sounded like they were, I'm not sure the word, but they were picked out, like this was specifically directed to them. And when Paul went out the order, and I've been in touch with Paul quite a few times, this order was to the entire league. It wasn't supposed to be directed to one family. I don't believe I'm misunderstanding anything. Paul, am I correct in saying that on your behalf? Yeah.
Well, the intent was to give it to the entire league, and then there's also some understanding was it was probably only one family that may challenge it. But the intent was to throw it out to a wide paintbrush to all members of the youth league, not so you're not disincluding or including or singling out any individual. But the end result was, no matter how you put it, that probably would have been the case, no matter which way you painted the brush.
And the only reason that we sent it to the one family is because they're the only family that is registered an exemption with the league. And so all other families are already expected through the prior orders to be wearing masks.
And I understand that. I actually, I want to make it understood, at least the motions, because I believe that they think that we're singling them out, and that is certainly not the case. And I want to make sure, at least the board, at least my position on the Board of Health is certainly not singling out one family. I mean, and they seem very upset and made several calls to people that they felt like they were singled out by Paul, and that Paul was doing something wrong. And as far as I'm concerned, Paul did nothing wrong, and I don't want to see him take the blame for this. And it just kind of is reflecting only Paul is not in trouble. I might use that word, but is the one on the hot spot right now. So I would certainly, hopefully, if the motions get this meeting notes, they realize that we were not singling them out. I guess that's all I want to make sure everyone knew.
No, I go along with that too. I don't believe it was an intent,
No.
intentionally or otherwise, to single out one family. One of my questions would be, what happened, Paul? What changed to make the order a little stricter than it is, or what?
Well, the original order was from the state, the governor's, latest revision was August 13th for, youth and adult sports, effective August 17th. And that said, masks are required by all players, spectators, coaches, umpires, referees, the alike. There was an exception for players with medical exemption. They started playing. Obviously, you guys are well aware that we've been on the West Newbury Youth League in regards to masks for a long time. I was unaware that masks weren't being worn. I was unaware that there was someone with an exemption. I got 3 complaints a couple of weeks ago in regards to that, and that's what I started asking questions. I reached out to the state for advice, what to do in this situation. And that's what brought us to this point. We would have addressed it 3 months ago if we were aware of it, but this is all new. COVID is new to everyone. So everyone, the youth league, myself, the residents, the community, everyone's trying to do the best they can in the situation that we're handling. So I guess there's no right and wrong answer way anything's been handled. It's new to everyone. That's the reason why it came up, is I started getting complaints, asking questions, and then who sent an email to Youth League, and then before I was able to send it out, they had shut down 2 weeks on their own. Some concern, which I thought that was great. We extended another week to make sure we get the full days. We can try to see if we had numbers go up. Luckily, there was no increase in positive cases due to any of their close contacts. So that was a good thing. So we had a conference call last week, and that's what I told them, that, Youth League could resume the sports as they were, but there was one problem that I was getting called with regards to the no facial coverings. And that's what prompted the order. I was unaware of it for the last 2 months until people started calling me, and I said, what are you talking about? And then, that's how we came to this point.
Okay, what's the state?
So
You got a question, Jack?
I just wanted to comment, Paul, the reason we didn't bring this to your attention at all was because we were in compliance with the state guidance. So the only applicable guidance was the state guidance, the August 13th guidance. Therefore, we felt no reason to bring something to your attention that was in compliance with the guidance. When we had our call last Thursday, the 15th, to talk about resuming youth sports, you brought to our attention that you were aware that there were several cases within one family that were not wearing masks, and we cited the medical exemptions and so forth. So it certainly wasn't that the youth league was trying to hide anything from the health agent or the Board of Health. We just knew that the medical exemptions that we had in hand were in compliance with the August 13th, effective August 17th guidance. We felt no reason to bring that to anyone's attention. There was no local guidance at the time citing anything different from the state guidance. So that's the rationale behind the youth league's decision to allow those 2 children from that one particular family to play without masks, given the medical exemptions, which as you mentioned are allowed in the state August 13th, effective August 17th guidance. We didn't think there was anything to bring to anyone's attention.
I have another question. If the medical exemption is still in effect, can we legally require that family to wear masks or not to play? I mean, the exemption is still there. They've done nothing wrong at this point, because I know. In the state, I don't believe Mr. Brown said we absolutely can't do that.
Well,
But what I'm trying to get at is, I don't want to sit here and make a decision when the law basically says they have the right to participate.
They do, but under the guidance from the state and talking to town council, the Board of Health has the right due to the public health emergency to put stricter guidance than the youth guidance. And again, that's why I issue the order with the caveat that, you know, they need to wear a mask while playing. If they cannot play the whole time, then they would have to, you know, get off the field and take a mask break. So you have to allow them to play with reasonable accommodations. And that's the key word, is reasonable accommodations. So again, that's what was stated in, and I think you guys have all received the email correspondence from a gentleman from the state called, I think, Gerben something. He's the contact for the youth sports, and that is his response to my question. And then he suggested I talk to town council. I talked to town council in person. And I believe Blake had also talked to town council, and then, yes, the Board of Health does have the right to provide stricter guidance as long as you provide reasonable accommodation. And that is, I knew all that information prior to me issuing the order, because I knew it potentially could be a problem, and I wanted to make sure that I was in line on what I can do or should do prior to making that decision.
Make a comment, please. So the way I understand how the state regulations come down, and then the interpretation at the local level, which is encouraged by the state, even the federal government wants it to trickle down to the local level. I believe that the argument is the West Newbury Board of Health is to look at the general, health and well-being, and in protecting the general population of West Newbury as a whole. I think that what we're requiring here is that everybody wear face masks unless they can social distance. And with that come along with playing the game makes it more difficult. But the idea is that the practice of wearing masks helps protect others from you spreading the potential COVID-19 to someone else. I think that what the state is doing right now is the intention of saying that participants may have an exemption to wearing a mask if they have a medical exemption by doing that. I don't think the intention of the spirit of that would be to say that we're going to let this happen. We're going to, because there's a medical exception so that they can be inclusive. But with that, we're going to expose potentially other participants to the infection. So I think the key that I see here is that it is appropriate for us at the local level and for Paul to interpret and come up with what his guidelines are going to be. That's the public health agent. What's missing here is we have a medical exception, so that's beyond us as far as to determine and critique whether that's necessary or not. It's legitimate, and I think for this, for this family and for these young kids that want to play, I think we need to zero down to the whole accommodations thing. And so that's why I would like to ask the West Newbury Youth League what kind of accommodations have been put in place so that these children can be included in West Newbury Youth League sports. That's the key to making this thing work or attempt to work. I understand the concern about the youth league having its own policies and to defer to the Board of Health as far as making these determinations. But the Board of Health's job, I think, is to try to set guidelines in place to protect people from this virus. And I think that accommodations is something that the West Newbury Board of Health has no right to make any recommendations on that because we're not the West Newbury Youth League. So what I'd like to ask Jack is, what have you done since this email came out? Have you thought of any accommodations that can allow these kids to participate without a mask, but not put other players at risk?
Well, that's where the challenge is, right? I think that the question and the answer is subjective. Soccer, I don't know what type of accommodations, what are the parameters of what are the accommodations intended to accomplish? To keep an unmasked player a certain distance from other masked players? And if so, what is that distance? I don't think we could define accommodations until we understand the parameters of what's trying to be accomplished by offering the accommodations.
Well, I think that I think basically what I just said was that if social distancing can't be done, any participants while they're playing the sport, because they are not wearing masks, then some kind of accommodations need to be made within the game, the rules of the game, the way the game is played, to work out a way that these kids can participate, but not necessarily singled out. And to have the youth league try to figure out some way of doing this, because obviously we're living and reacting in a time right now that's never happened before. We most certainly have to think outside the box and figure out a way that we can do this. Because ultimately, you have to look at this and say, either there's ways that we can do this, or we can't play the sport. And that's kind of what I'm asking, because I don't want to be in a position where I have to say to a family that it's okay to, those 3 kids over there are fine to not have a mask. Have they been screened? Do they have negative tests? All the things that go into like professional sports to try to create an environment that's safer. So that's kind of what I'm asking, Jack, as far as, being real creative in ways that you can allow medical exceptions from not being required to wear a mask, be able to participate.
I think the first step in that discussion would be, again, we would need to know what parameters the Board of Health would want us to maintain so that we had a set of parameters to work to try to develop accommodations. In other words, is it okay if an unmasked player is playing immediately adjacent to a masked player? If that's not okay, what's the required separation? Or is there a certain time where an unmasked player and a masked player can be adjacent to each other as long as they're not adjacent to each other for longer than a certain amount of time? So these are the questions. We would need a set of guidelines to work backwards and reverse engineer what accommodations might fit the set of parameters we were given.
Well, I think that if you follow the social distancing guidelines, which say, probably 6 feet away.
Correct.
And with that, it doesn't qualify less than 6 feet in a period of time based on somebody not being resident.
Well, the social distance requirement is greater than 6 feet, and for a close contact, it's greater than 15 minutes, and that's been decided on. It's 15 minutes cumulative over a 24-hour period. So that came up in some emails regards to, school bus rides. If you're on a school bus for 10 minutes in the morning and 10 minutes in the afternoon, that's cumulative 20 minutes. You're a close contact if the individual is positive. So I would say to be consistent, greater than 6 feet, you need to be greater than 6 feet from each other. And if you're within 6 feet, then it can't be more, cumulative more than 15 minutes. But I think the main goal is to have greater than 6 foot separation. And if you're some reason closer to that for 30 seconds, I think, that would still be in the, spirit of the intent of social distancing.
So is there any safe way that mask distance and play with mask distance and some place where we're not thinking that we're transmitting this communicable virus? If kids play for a certain amount of time, I don't know, you limit the amount of time that they're out there, they can't play at the same time. I don't know if there are ways that we can do that. or it's just ultimately a situation where, they have, when they're playing, they have to be 6 feet away.
I think given the nature of the sports, but as I'll speak specifically for soccer, it's difficult on the field to be able to maintain that 6 feet of distance unless we did something like have them play goalie and, monitor that position that would be 6 feet away. But just given the nature of soccer, I mean, you're taking the ball away from other players and you're, running and lots of people going for the ball at the same time. I think it's challenging to be monitoring that and monitoring the play.
So it seems like there's not going to be that the youth league won't be able to come up with any kind of creative accommodations to let these kids be able to play with mass children also. There's no creative way of letting them participate. I kind of get a sense of the game and how the game is played, and I would see that there would be, my perception and my thoughts would be that it would be very difficult to come up with something. But is there any other way that you can do that so these kids can participate safely with others?
I think, not trying to answer, Jack, or, but I think that's what he wants us to do is decide as a board of health or as a health agent to give him, I think, correctly, to give him the parameters first. So I guess we need to spell out the parameters and then leave it up to them after. Does that sound fair? Do you want us, he's trying to ask us for what are the parameters and more,
Personally, thinking for myself, I don't know that much about soccer and much like football. So for the board of health to be making parameters and all that kind of stuff to them, I think is a little bit ridiculous. Unless we can sit down with the youth league and figure out what's the, I'm dictating to them is like telling me telling you how to do a septic system. I mean, if we sat down and hashed out ideas, they know the sport better than we do. They know what they can and cannot do, and they know what they can within the, if they can do certain things to keep the kids 6 feet apart, or, better than I do. But for us to tell them how to work, we're not the experts in the sport, they are. So maybe between us or them and Paul, I can come up with some idea of, how to do this so they can accommodate the kids that need to be. Instead of just saying that's out, we can't do it. I think there's got to be a way. Because let's face it, this is going to be around for probably another year. Close to it. So we're going to need to figure out something. It'll be basketball, football, hockey. The next year starts up again with baseball and the rest of it. So I think they need to sit down and maybe work together and figure out some way we can do it.
I mean, I feel that the basic core requirement that the board is that all participants with facial coverings when playing the game. I think that all facial coverings must be worn by all participants when they're not playing, and for coaches and for spectators who can't maintain 6 foot separation from any other person. I think that West Newbury Board of Health would support, this is my own personal opinion, encouraging the West Newbury Youth League organizers and coaches to modify participation so that reasonable accommodations are offered when necessary to all participants with medical exceptions for wearing masks so that they can participate. But I think what we're saying is that everybody wears masks, and if not, they have to be 6 feet away. Everybody that goes to the game has to wear a mask and be 6 feet away. I think those are our guidelines. And we're basically following this back to you and saying, what kind of accommodations can you make within this game so that these people, that these players can not wear masks for that reasons can participate. But what Paul basically said, and I support that, is that spatial coverings for everyone, unless they can be 6 feet apart, and ultimately refer back to the West Newbury Youth League to work within those two parameters that we're endorsing. That's my opinion.
Yeah, because I think that, unfortunately, I mean, we're not taking a vote again, but we definitely know that every participant is going to wear a mask if they're closer than 6 feet. That's only from a Board of Health standpoint, is what I think Tom's saying, I agree. As far as, and I see Bob's point, as far as we can't make up the rule, we can't tell them how to adjust the game. Is that what you were getting to? Right. So I do think we're all in agreement that every participant is going to wear it, with disability or not. And unfortunately, the youth league is going to have to figure it out. And I don't know if that's a cop-out, but I think that's one thing we can do, Tom, is to enforce that.
I think you're probably right, but I think they probably need to sit down and work with Paul with the parameters of how we,
Parameters need to be fine-tuned beyond, you think this way that we can qualify, disqualify, this being an issue within play, like the qualifications on time and distance and, those kind of.
No, I think it's gonna be too hard to track the time and the distance, so I think the only way to do it in spirit with what's been going on for the last 6 months is maintain at least 6 feet. Right now in school, the school committee has voted no mask, no general population. So if their option is if you cannot wear a mask in school, you cannot be in the general population, you have to do fully remote learning. And then everywhere you go is wear a mask, stay 6 feet. So I think that is a guide, is that, stay 6 feet away and then see if the youth league can work with the parameter of you need to stay 6 feet away unless you wear a mask. Like you said, Tom, they may be a little creative and think about it. I'll be happy to talk to them and discuss it. But I think at this point, my order stands. You guys need to take a vote as to uphold it, rescind it, modify it with your own word or something. You guys got to have some stance tonight. Either modify it with your own words, Tom. That's basically rescind my order and make a new order, or uphold my order as is, or come up with something. But you guys definitely have to take a vote, roll call. I would suggest a roll call vote to, someone make a motion, roll call vote to accept, approve it, discuss it. That way it's on record. You guys made the final say. My job as health agent.
You good? Are you good with that?
I wrote up an outline of what I thought we could adapt to Paul's regulations. And I want to participate in some, so you can look at it and anybody else needs a copy of it, it's just proposed. I'll be in this.
No, but I would recommend you guys read it, discuss it, make changes, and then read the final order that will supersede my order. And that will be on record for the youth league to run with parameters as suggested by Jack.
You want to read it so people can hear what we're talking about?
Oh, yeah,
I think that would be a good idea, Tom, yeah.
just read it loud, Tom, so the mic can pick it up.
West Newbury, Board of Health proposed revisions to facial covering requirements for the West Newbury Youth League. Number one, the West Newbury Board of Health requires all players to wear facial coverings if they cannot maintain 6 feet away from other players while participating in the game. This practice assists in the protection of all players from possible COVID-19 transmission. Number two, facial coverings must be worn by all participants, not when not playing. For coaches and spectators who cannot maintain 6 foot of separation from another person. Number three, the West Newbury Board of Health supports and encourages the West Newbury Youth League organizers and coaches to modify play or participation so that reasonable accommodations are offered when necessary, so all participants with medical exceptions for wearing facial masks can participate.
Do you want to make a motion to,
Well, the only comment I have, number two, Tom, is currently the youth guidance mandates that all coaches, staff, umpires wear facial coverings at all times. Does not matter the separation. So that's kind of, you know, being less stringent than the guidance for coaches.
What I'm saying is.
Yes, less stringent, because right now the youth sports guidance mandates that all coaches, staff, umpires, referees, spectators wear masks at all times.
Okay, so.
The only exemption applies to the players in the youth guidance.
Okay, and then we can take, I'm fine with taking on number two.
yeah, I'm good with that. It's already in place, so.
Paul, should this be added to your, what you wrote?
I mean, you can either add it or you could, you know, you can modify, take mine, but it's similar to mine, just a little different wording. So I think it'd be probably cleaner just to rescind mine and redo yours all at once. I think it'd be cleaner that way. It's pretty much the same thing, just a little different wording. And I think mine, I didn't have specified any distances. I specified in close proximity to each other, or I suggested that if you needed a mass break, to, you know, go in a designated area. So you may want to add something like that in, just so if they do need a mass break, they have a designated area.
Well, it's certainly, if the board doesn't have any, because we're just talking about a little bit of wording, you know, subtracting, and we have to connect this and add and subtract. I'm not trying to make it more painful as is. I will be perfectly happy with accepting, but it will make it for both what Paul already has charged out, but that's,
I would just rescind mine and do number 1 and 2, number 1 and 3 that Tom had drafted. That way they have the exact wording. Guys, it's up to you. I see, ready to talk, Jack. Any comments, questions?
I just wanted to ask, the audio is a bit choppy, so, and a bit of an echo, so it's difficult to understand everything that's being said by the various folks in the room there. But
Yeah.
is the language, I thought I heard applicable to West Newbury Youth League. Is it league specific to West Newbury Youth League, or is it applicable to any youth sports group playing on a town court or on a town field?
That was a valid point. We agree with that. So I'll have Tom reread his order, a little louder and with those modifications, because yes, you're right. You know, my order was to all individuals playing youth sports, I think. So that's a good point, Jack. Thank you.
Paul, in front of you?
No.
I was gonna ask you to read them and we could accept that, but. Copy of those, like, yeah, we're good, just, we don't have a copy of those. Because it seems to me what Paul ordered was basically the same thing, but, you know, this is what I'm saying, he said add and subtract. I mean, I was content with Paul's, I'm sure Tom was mostly, you know, content with it, but I can't speak for all of us.
Yeah, I think that, what was missing was the, I believe what was missing, I believe when you in politics, is, more explicitly, defining attempts for accommodations. And that would be the youth league that does that in the Board of Health.
Mostly talking about number 3, though, Tom?
Yeah.
Sorry for starting. So why don't we rescind his, and, my suggestion would be to modify his, and put up chapter 3, subtitle 3.
Yeah.
Would you guys agree with that?
If you want to hear what Paul.
Yeah, I do, first, yeah, if he has it.
But it also, these, you know, usually and Paul work together to see some way of accommodating those that, you know, want to play but haven't had it. You know, I realize that this is not the best way in the world out there, you know. We're not going to please everybody, we got to somebody. But at least I think we're going to try to accommodate everybody that we can.
Oh, brings it to anyway, thanks, Paul.
Mr. Paul.
I can drive it on that.
So Paul, basically the last 2 sentences of your,
The first
in the first paragraph.
Correct. It says, with that said, and then the last sentence wasn't quite the order, but I did recommend that the youth league reach out to the individuals to make accommodations. So you could kind of include that as one of
I
the,
mean, I think that's pretty inclusive of what we have to say. But we could maybe incorporate some of the wording, from what I said and what you said, just to
Yeah.
three bullet points. Or something like that.
yeah, sounds good.
So we would vote to, that we voted for.
Amend.
Yeah,
I think we already said it. And then,
I think amend what, you know, because we're keeping part of Paul, so I think the word would be we're amending it. That sounds to me correct.
yeah, I think that would be, we're not gonna, yeah, we'll amend all
So, Tom, do you mind seeing, you seem to be doing the loudest voice. Would you mind, pointing out what it will say, even if you read Paul's and put yours in there, do you mind doing that?
I think it's just, the wording. I think that I think the next kind of law, chapter 11, section 1.2, the Board of Health, will require that all players must wear facial coverings at all times if they are unable to maintain 6 feet distance from other players. And then I think that, Newbury, and I think that, we could also include in, if a facial covering break is needed, then these individuals must go to the designated area to remove their facial coverings. And then I think that, we could add into it, basically the, Paul's email says that, the West Newbury, Youth League should reach out to those individuals not wearing coverage, educate and encourage the use of wearing them. I think that, that's an important thing, but I think the gist of this is the fact that, we have this issue, we have medical exception for wearing masks, and the league, the West Newbury Youth League, which I mean, West Newbury Board of Health supports and encourages the West Newbury Youth League organizers and coaches to modify player participation so that reasonable accommodations are offered when necessary. So all participants with medical exceptions for wearing a mask in the district. I think that's where, I think that's where we're going.
So Jack, you were getting to the point, so do other teams come to play flag football with West Newbury kids, or it's just through West Newbury Youth League? I think that's what you were trying to mention about the wording.
Well, no. So West Newbury Youth League is the only group that plays flag football in West Newbury. I was just questioning whether, for example, we have, if this is going to be with us for a while, we have, for example, PYSA soccer that plays in town, PYL lacrosse that plays in town. From time to time, outside baseball groups rent field space in town. So my point was, I wasn't sure if this was applicable to exclusively West Newbury Youth League or any user group using town fields, essentially. For example, the high school uses Pipe Stay fields. I just wasn't sure the scope of.
I agree with you, and instead of trying to rush this tonight, I think all parties involved understand. I think what we should do is rewrite this out, but for now it falls, what's the word?
Order.
Order stands until we can change it next week, because I think we all have good intentions, but we gotta write it down and accept that. Is that okay with the board?
Yeah, I don't want to rush into this.
So as of now, I would say that falls.
Yeah, I mean,
Stands.
I didn't agree to something tonight that that we do.
Yeah, right.
I think we need to sit down, with Carl heads down, the Paul down. And maybe put a little thought in, maybe work with the youth league. Something in there so that, it's coherent,
Yeah, I agree.
and makes some kind of sense.
But the other thing I would like to, just so, I keep saying it, I'd like to take a vote on to at least say that Paul's order stands as of now. And then we'll address this at a later date, because until we accept Paul's orders, we may have issues going on. So I think they ask for a vote to accept Paul's orders as they stand now.
Well, I think if you do that, and I would add in there the caveat that's 6 foot, because that way Youth League can work on the parameters of 6 foot separation. But I think the holdup is really the language, whether it's West Newbury Youth League, whether it's all participants, and the same thing we do with baseball, it was all players in West Newbury fields. So I think that's what's going to come out of it. But I think if we can give the Youth League some direction, if you guys want to, vote to accept my order with the exception that, I never specify the distance. So specify the distance of 6 feet, and then we can reconvene and work on the full order to make sure we encapsulate all the groups coming into town and all the sports.
I'd like to take a vote and accept Paul's orders the way they were, except with putting in a distance of 6 feet apart from each other.
I'll second that.
All those in favor?
Aye.
Aye. Opposed? 300, Jane.
Any discussion, comments, Jack or Hathaway?
I just wanted to add, as you're crafting the further language, usually the U10 soccer is playing against other towns. This year it's just Groveland. So I think the language around any sports played within West Newbury sounds good.
All right, no, that's pretty much, I think that was the intent of the whole baseball, and I'm glad Jack brought that up because we weren't really focusing on that point. Get anything to say?
No, the only comment I have, Paul, is that, the Youth League will maintain consistency in that we will use state and local guidance as our roadmap for what we try to do as far as COVID, but there just needs to be some clarification based on The directive we passed along on October 16th which was no mask, no play. The pushback.
Well, I have a problem with that, Jack, is because no mask, no play is not what I put in my email. So I do take offense that I specifically did not put no mask, no play, because I knew we had to give a little bit of opening for, accommodations. That I never, any of my emails that I say no mask, no play. That's why no mask, no play, but you're right. I did say that, but then you need to have a mask break. So what the email that went out was kind of a little bit more aggressive than what I had said in my email. You see what I'm saying?
I believe what we forwarded, Paul, was the body of your email.
Right, but I think some of the emails I saw was no mask, no play, that's it. It had nothing mentioned about, reasonable accommodations, reaching out to the family, mask breaks. It was just no mask, no play, see you later. And that's not really the intent of the email. The email was that if you didn't have a mask, then you needed to, you had to separate. You had to go off in a distance for a mask break. So I understand what you're saying. Like, again, like I said, none of us have done this before. So I just think we got to be, like you said, consistent as what we're telling people.
Right. So my recollection on the 15th conference call, Paul, was that the phrase no mask, no play was used. The accommodations didn't come to light until October 17th.
Well, no, it was an email I sent you on Friday. I says, per our conversation yesterday, I sent you the email. So yes, we did have a conversation, and then you wanted an email because you didn't want to wait until Tuesday night, the board meeting. So I said I would do it myself, and I put it in an email. It says, Jack, per our conversation, it did talk about mask breaks and reaching out to the family in question to provide, educate, encourage them to wear masks. So.
Right.
Right, you kind of, went on one side of what we talked about, and you went on the other side.
Well, I believe, Paul, the accommodations didn't come to light until after we had communicated your October 16th policy to the family.
Right. It could have been, but the email on the Friday did say, discuss and educate and encourage the family to wear masks.
Right. At that point, we stopped communicating with the family because the Youth League was beginning to become the conduit for Board of Health or health agent policy directly with one family. And I was extremely uncomfortable with that because we are not health experts and we are not legal experts. So we had stopped communicating directly with the family prior to receiving your email, Paul, talking about special reasonable accommodations. We had only communicated your prior position, which you communicated to us in an email the day before, which to my recollection didn't have any wording in it regarding accommodations.
Right.
So we just wanted to get out of the middle of it because we have no place being in the middle of it. That's my point.
Right. So I think at this point, the board voted to approve my order, which was you need to have a mask to play. And then it was amended that if you don't have a mask, you need to be greater than 6 feet. So that's kind of lightened up on what you said, no mask, no play. So you could play if you maintain greater than 6 feet. So it's up to the Youth League to determine if that is possible, to allow play and have that child still participate in some capacity. And it's up to you guys to decide as to what capacity is reasonable and to allow that child to participate in that capacity and maintain at least 6 feet if they choose not to wear a mask. If they wear a mask, then they can go play as regular, and as we discussed, frequent mask breaks as necessary. So I think does the board agree that's where we're at?
Yes.
So okay, so Paul, so just so I make sure I understand, because I don't want this to get sideways. One of the reasonable accommodations that you and I discussed on the phone the morning after the October 16th email was forwarded to the family, and then we received a reply from the family. or actually you received a reply from the family with the Youth League on copy. One of the special accommodations discussed the following morning was that a player, if a player is able to wear a mask for any length of time, an accommodation could be that the player could go on the field with a mask and then come off the field when he or she determined that it was time for a mask break. Should that be another accommodation?
I think that's a great accommodation. They're wearing a mask when they're within 6 feet, and if they can't wear that mask anymore, if they're willing, if they come out of the game, that's a great accommodation. That allows the child to play, and it protects all the other athletes, because the child is wearing a mask within 6 feet.
Okay, I just want to make sure, because the 6 feet wasn't discussed on the phone as an accommodation, but going on the field with a mask and then staying out as long as you can, wearing a mask, and then just coming off the field when you need a break, and then of course another masked player would go in as a substitution. I didn't know if you wanted to make that part of. We just need to understand the parameters so we can work backwards and figure out accommodations that achieve the parameters that the Board of Health sets.
Making the accommodations there.
Right, it's up to you guys to make the accommodation, but yes, you gotta have, if you don't have a mask, you gotta be greater than 6 feet.
Okay. Okay.
Sound good?
So what I'll do is we'll recap an email tomorrow, I'll send it out to you tomorrow with what the vote the board taken, and then we're gonna discuss the, expanding it to other places.
Paul, does it make sense for you to post this order on the Board of Health page at the town website, just so if we're asked, the Youth League can just refer people to the Board of Health?
Well, we could, but I think it'd be pertinent for the Youth League to send an email out to all Youth League participants and say, the Board of Health voted in order, this is the new requirement for the West Newbury Youth League. And then we're gonna work on changing that language to include all groups. Because the only ones interested in this order is the people that play West Newbury Youth League. So if you have all the email contacts, send a mass email, just like you did when you shut down the Youth League, then you can send a mass email that said, as a reminder, as an update, West Newbury Board of Health issued an order, Board of Health voted on it. Here's the order.
Right. I think it would be effective to, as much the same as you do with the Triple E notices and COVID update notices, to my personal opinion would be to have it posted on the Board of Health page, and we could just simply put a live link in our email blast that's a link to the Board of Health page with the posted notice. That way, whether it's a Pawtucket user group or, we're not being exclusive, not singling out West Newbury Youth League. It's just anyone can refer to this, order or notice that's posted on the town webpage at the Board of Health.
I think we can work, we can work on that. That's reasonable.
Yeah, I think that's a reasonable thing to do. Yep.
Overnight, Jack, but I think that's reasonable for us to work on and get it done as soon as we can.
Okay, thank you, Blake. That way we're simply referring folks to the Board of Health's order. We're not actually laying out the order in our own words, or we're not trying to explain what the order is or is not. We're simply referring people to an order that was posted by the Board of Health. I just think it's a cleaner way to go.
I totally agree with you.
Okay, are we done with this coming up?
Yeah, that sounds good.
Because we need to move on. Everybody else set?
Yes.
Okay. Town report.
You guys kind of.
Yep.
You already
Already
done.
signed it, both right here. What I can look at that.
Halloween.
So I sent you a poster that I had, I got this from a bunch of health agents, made it up. I modified a little bit, changed some things. I sent it to the selectmen and been posted on the town's website. Selectmen reviewed it, discussed it last night. I think you guys set a time, Rick, for Halloween?
Yeah, we're gonna be 5 or 7.
Believe so.
Previous years, there was, somebody suggested possibly going a little bit earlier, 4 to 6. But it's a Saturday night and, so there won't be commuter traffic coming home. And it just seemed to make sense to go with, a couple of reasons, to go with what has been done historically. There's enough confusion in the world as there is. And then secondly, quite honestly, I think part of the excitement for kids sometimes is that it's at night.
Right.
And if it's all in daylight, then, it's 5:45 right now, it'll still be slightly light at 6. So, it is a kids event. So that's kind of what we can.
Okay. 117 Indian Hill.
Oh, wait, Bob, Sandy Taylor, you want to respond to her?
Is that the one who asked us to, is the book, how's this, I guess while we're on it real quick, is the board all in favor of keeping trick or treat? I mean, I certainly.
I personally don't have a problem with it. If you don't want the kids to be fun, what you like them?
It's your call. No, you're the board of health, so this is kind of your call, but from the selectmen's perspective, I think it's only me speaking for the selectmen, but consensus on our board is that if you don't want anybody to come to your door, then leave the light off. And don't answer the door if people come knocking. And I don't think people throw anything anymore. I was a kid, of course, we did this.
Yeah, no, I'm fine with it. Yeah.
Tom, you fine with trick or treat?
Yeah, I honestly think that, parents should make a decision on this, that they get on board, because, I'm not sure if I have little kids right now, if I'd let them go through just randomly.
I'm going to, Tom.
But I think that, they can use the discretion, maybe there'll be small neighborhood parties and stuff like that, and that will be a better thing. But I think that, that if we do anything, at the town level as far as, something, information on this, I think it's important to, also let people know, that if they don't want to participate in it, they will certainly, just like what Rick said, they need to know that that's the way to not have to.
State guidelines, Paul?
No, but I think, the police department, and I think Jeff, the chief, is gonna, send a notice out about shutting lights off. I think that's what I remember a conversation with Angus about, so, but yeah, we're still a couple weeks away, so I think that's gonna go out prior right to the event, just to remind residents that if you're not comfortable with the event, then shut your light off.
I think at this point, with the teams, very dynamic as far as going on, I think that, it needs to be something that potentially, coming up close to that time, when we send or something, we hopefully have an outbreak or something like that, right? Just like us, it's going to be very bad weather or something like that.
So you probably should, Ms. Taylor, was it? Yeah, you probably should she wrote us, asking us, board members, if we would reconsider holding Halloween. You can tell her that it's the best interest to keep it going. Yeah. Don't use the word best interest.
No, I won't.
Come up with something else for that.
Yeah.
Be careful. Expenditures.
Wait, 117.
Well, he's away right this, what's that he's going to do?
Oh,
That's why I didn't know if we would just accept he's right here, so.
I have, you guys are doing other stuff for a few minutes, so I'm gonna run out.
We'll get right on it, as soon as you come in, we'll get right on it. Sorry about that. All you want, yes.
Yeah, that's, they're just looking for a septic, extension, like we've given the other ones, but it'll cover another extra year. So it's just another extra year for 117 Indian Hill. They've already got 1 year extension like other people have. So it's just another year extension.
I'm fine with that. Health expenses.
So I know Jane had put something in email because Blake wanted it, but I gave you 2 pages. I had talked to Angus, last week and told him that we're gonna need some extra money because of the unprecedented, COVID situation we had last couple of weeks ago. And he was aware of the situation, so he just said, come up with some numbers. And these are the numbers I came up with, and then, more than likely he may add some more because those are still guesstimates. But you can see based on the first one, you can read it. If you have any questions, let me know. But he was well aware of the situation. The CARES funding does go into the end of the year. And then January 1st, there is some talk that there's going to be another round of, we're round 2 of the CARES Act, and there's talk there's going to be more additional funds next January 1st, which, as you see by the bottom, with the last page, we're going to need it because going in, we're going to be behind, we're going to be in the negative quite a bit if things keep on going.
That's why I mentioned it to Jamie, put it out to us, so we're all kind of waiting that.
Right. So if you want to read that over, if you agree with it, I'll submit that to Angus tomorrow as to what we're looking for. Again, it's just based on what we have data with today. I mean, it's just, those are real numbers.
Yep, I'm assuming that I got the alien up, so I was able,
I'm fine with it too. It's,
you know, if everyone had a chance.
I was good with that.
But do we, no, this is good, I'm good with it. Did you just say that we may be expecting more rounds of funds?
Well, I don't know how they're gonna just give the states and towns money with the CARES Act and all of a sudden on January 1st, cut it off when the pandemic's still going on, so.
I just didn't know if it's talks are out there that they.
I think I'm hearing rumors that they're going to, but I don't know how they cannot. I mean, because I don't know how they cannot.
We'll take that as a couple, so that's all I can
Right,
do.
so I'll submit this to him tomorrow. And then some of the numbers that Jane had given you is reflected in this first paragraph, what's left of that original account.
So-
What happened to Jason?
Oh, that was my call. I saw the writing on the wall, and I'm looking at the time on the wall now, and I didn't want to hold Jason here until this time.
So I agree.
So that was my call. I felt bad to be sitting here for an hour or two, which I call pretty right. And Jane's gonna ask them, maybe at our next, sometime early in November, we have to start.
He's all set with the town. I sent you an email, Bob, and you were on delivery.
Yeah.
And he's
Okay.
good with the 10th, because the 3rd is the, election.
We don't want to deal with it.
No, no.
So if anyone can maybe check this schedule and get back to Jay tomorrow, or this is all it's next week
Okay.
for the 10th.
All right, 83 Ash Street.
As soon as Rick.
Yeah, you guys got the septic right there. Septic repair for 83 Ash Street. It's right in front of you, Bob. You want to look at it?
I'm just letting you know.
Is this one?
You got one, Tom?
Huh?
You got a plan in front of you?
The green now on it. Yep. Jim Sierra.
And,
Yes, yes, ma'am.
you got your payroll call?
Yeah, Blake has it, yeah.
Tom hopefully has it.
Yes. So it's just a septic repair, for the little log cabin on Ash Street, just almost on the corner of Ash and Middle.
Oh,
So straightforward, 2-bedroom, pump to a, septic system. I don't think there's anything special or fancy with that one.
no, they just said, I see unfortunately they have wetlands out there.
Wetlands,
They need to be far away from it.
retaining wall.
Yeah. East side of the ground quite a bit.
That's-
Is that a water or is that just a pump chamber?
I think it's just a pump chamber
Yeah,
now.
no, it's just, it's 500.
Yeah, because it's only 2 bedrooms, so a 500-gallon pump chamber is sufficient.
Is that all that is?
Yep.
Variance waivers to area 71 feet. With it, I was just looking at the variances, what they were requesting, it's no more than any other system in town has. You have any comment, Paul?
No, those already been revised a couple times, yep.
No, it's good.
No, he's looking his water. Email in your folder for, I think it's the Boy Scouts looking for,
Oh, that, yeah.
Yes, I was still got people. Just added the second line, Tom. I'm over after you have all three houses.
You can just sign them after, Blake, if you want, after the meeting.
I can do that too.
You get another set.
Let's, like, we set them all, Tom, you keep them over there, Tom, and then after we do the next one.
Oxford Place.
Darko's place. I'm guessing 44 Cotton Street is not here.
Correct.
And this one is,
32 Oxford Place.
okay,
Same thing, septic repair, 2 bedroom. On this particular one, we got wetlands like pretty close to the system. We're, I think, 46 feet away. So they, installed a Waterloo, biofilter treatment unit in the front yard to compensate, the less than 50-foot setback to wetlands. Their plan went to conservation last night and got approved by the conservation. So as you notice, the 2 tanks, septic tank and pump chamber in front of the house, between the house and the street, pumping over to the leach field close to the street as possible. So the tanks and leach field are further away as wetland as possible, and then maintaining the 10-foot separation off the house, off the property line. So not much else you could do there.
125 feet in the well, so.
Yeah.
I didn't realize it was that close to wetlands. It's close, I didn't realize it was that.
Oh, he's got 2 proposed stone walls.
Yeah, one's gonna be a rubber stone wall, one's gonna be a stone and mortar. Little medium.
Interesting. You thought that was all good with you, Paul?
Yeah.
I know you give it to us, but you went on. It's gonna save these and you're gonna be out. First, I thought you were bringing in a bottle of wine.
right?
These 3. That all done? Okay. They're all done.
Well, then usually conversation sure ate up much time, huh?
Yeah, certainly did. we did cancel our appointment, we had an appointment coming in tonight, I don't know, and we just figured it wasn't fair to him.
It was a pretty circular conversation.
Yeah, yeah.
Yeah, I still think they're doing basic passes the buck. Anyway. All right. Does Boy Scout want to use the town hall? Is that what you want?
It's actually Cub Scouts, well, yeah, I think the Boy Scouts do too, I think everybody, so I think there's, my understanding is a lot of, Angus called me on whatever, that's why I wasn't right back up. So we talked about this a little bit, and I guess he had a conversation with you earlier. And, I was approached by, Cub Scout, Cub Pack, and, so that's sort of the case at hand, but, there are garden clubs, there are other clubs and organizations and youth groups, that are interested in, and, it just strikes me, obviously, this is a difficult time, and everybody's having to compensate. And, we have public facilities, and, the question is, can we scratch out a way that we can safely allow people to use them and accommodate groups appropriately? Because, there's going to be, even if we figure out a plan that we think is safe and viable, there probably is going to be more demand than there is supply. So it then becomes an issue of what's fair. And how do you share a limited resource? And who's, do you preferentially let certain groups because of their demographic use it? For instance, and this is just a personal opinion, but if I had to bias, I would bias towards children, groups that include children, because social development is so important for them. And right now they're being starved for social development.
Right.
And I don't mean to undercut some other group, like say the Art Carnival. I'm not saying singling them out, I'm saying that, but it's just, I'm not trying to single out anybody else. I'm just saying that there are groups that perhaps it's more important that they have an opportunity to get together, from a long-term perspective.
Well, you don't know which email I read, I don't know if it was you, Rick, did you two communicate at all?
No, I think Rick, someone had sent an email to Rick, Rick sent it to Angus forwarded it to me, and I forwarded it to you. Originally, when COVID first hit, the Board of Health, through me, I can't remember whether, so I think the selectmen originally shut down all town facilities. And then maybe 2 months ago, the selectmen had a meeting, and it was discussed that myself and Angus would decide who used what facilities and whatnot for the permitting process. So at that point, we drew the line that no indoor facilities be rented. It was just outdoors. So a lot of people have come to us for the indoors. We've said, no, that's not right now we're not renting indoors, outside only. And then as we're progressing now, more and more people are trying to get inside because it's getting colder out. We've already, like you said, we've turned away a lot of people. So I think there's a lot of scenarios that come in play. So the public health side of things, the state does provide guidance for the number of people that can be in a facility of that size. But then the other issue that comes up, as Rick has mentioned, is to how do you decide who uses and who doesn't? The cleaning of the facility, which is a public health concern, whether the town has the resources and frequency to clean that facility. A lot of the user groups are don't pay, I guess. I don't know, I can't think of the exact word, but they don't pay for the use of facilities, so there's no extra funds coming in to pay for the custodian. A lot of the groups use it on the weekend. So it's a lot of things going in the pot. It's just, unfortunately, this is going to go on a while. So as everything else we've been discussing tonight, we got to look towards the future and come up with a plan. So I don't know if it's if we can make an honest decision about this tonight, but I think it's something that we definitely gotta work with the selectmen on, weighing on about the resources for cleaning and custodian to come up with a long-term plan for the next 6 months, instead of just saying, no, 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 because we could be saying no, no, no for another year. So I think we gotta think about it as to, I think the hardest thing is, I think the public health side of things is the easiest part, limit it to a certain number of people and make sure it's properly cleaned before and after. So I think that's the easiest part, but I think the hardest part is going to be for either the selectman or the town manager to decide where you draw the line in the sand if we use this as a facility. So I think.
I think what Paul said, and I don't even mind to say that. I agree, I think we're just gonna be, for you to come to us, I think we are just gonna be a small part of the equation. Because we can't say, I would say, at the end of the day, I'm not trying to pass the buck. Ultimately, I think it's probably gonna be a select.
You're probably right, but I think you're an important part of the conversation, and your perspective needs to be heard and listen.
No, I understand, so I don't think that I'm gonna try and pass the buck. I think it's inevitable that we're gonna have to start using it. It may get to half capacities. I mean, then what size bonuses, Paul?
Well, last I talked to Wayne, I think the annex, based on the current guide from the state, which we could be stricter, was I think it could handle like 22 people.
22 for the annex and 18.
I think 17 for the town hall.
And the state limitation is 25 doors, I think, so.
Yeah.
I mean, so if one of the roads gets it at 20, but.
I don't want to make a decision, I certainly want to think about it, but I mean, 20, you said 22 for that, right? That's, I'm trying to think what that would be in there. I'm not making a decision, I'm trying to think of the annex now for 22 people, I'll crap that decision is what I'm trying
I mean, that's based on 8 people per 1,000 square feet. But again, I think, I've talked to Rick about it and talked to Angus about it, that when we do open it up, then we can limit it to whatever we want. We can limit it to 15 people, just to give us a little more social distance and a little more spacing. But again, I think it's something that we're gonna have to discuss, evaluate and come up with a plan for, because it's hard now, and then come January, February, March, when we're still in this situation, people are really gonna want to, get that space into a space. So I think it's a good time to start discussing it, is to come up with a plan that we could have one approach and then maintain that for the next 6 months, not keep on changing the requirement every month. So I think it's something we can definitely.
So the state, I'm just gonna want to make this not only, state rule of thumb is 8 per 1,000.
8 per 1,000 square feet, max of 25 for any facility. So the public health side of things is the number of people in the cleaning of the facility. So the more it gets used, the more it could be cleaned, the more it costs, limited resources, limited town staff. It just, compounds everything. It's just another whole level.
So if I can say something on the cleaning issue, so there are probably a bunch of different ways it can be handled, but the ones that to me come first in mind, the town doesn't currently have the staff resource to clean it for that kind of group. John cleans his building, but he has, I think, quite a bit on display. Not necessarily everybody recognizes it, but I suspect he's actually pretty damn busy with what he has already. So it isn't like he has available time.
Right.
And so then the question is there a service, is there a contract service that could be used at the expense of those groups that use the facility? But that may quickly price, trucks got that. Right. Yeah, that mainly prices them out. They can't afford to be paying $100 or whatever it would cost to clean the thing. I don't think you can reasonably ask that. No, but that's another scenario where is there, and this maybe gets dicier, but, can you trust specific people within a group? You know, if you understand who the players are, is that safe? Do you then carry the liability? It's weird that you would carry liability there that you might not carry if you had a contract. You know, but, you know, is that another viable option? I don't know if it is or not.
Yeah.
I want to throw out ideas.
Right, I mean, I'm not trying to cut down, but no offense, this is gonna come off really bad, and I apologize. There's no one I trust that I can say positively does not have COVID.
Yeah.
We'd be asymptomatic, I could have got it 10 minutes ago, tested yesterday, negative. I mean, so I putting that, we trust someone to do it. No offense, it wouldn't get my.
Well, okay, I guess a retort to that is that I don't know contract. If we wanted John to do it, how do you know John? How do you know John when he cleans this? So it comes down to what is your practice? You know, how do you do it? How do you actually implement the cleaning? And what are the behaviors that are there so that what has to be cleaned? You know, you don't go and wipe every single surface, you know, you wipe the touch surface.
Right.
At least I know it's, I think that's the way that it's dealt with, is you try to make sure that you appropriately clean the touch surface.
I agree, but you understand what I was saying, I'm not condemning.
Yep.
I guess
This is not open conversation.
I guess with John, which we're not putting that on him at all.
Yeah.
John was doing it. That's what he knows what to do.
Yeah.
That's what I'm saying.
Yeah.
Someone like me runs it to me and I said, oh, I'll clean it. At the end of the day, I can say I know, but I really don't.
Yeah.
And we couldn't have that. So,
Okay.
That's my thoughts. That's in a board's position. That is my thoughts. You know what I mean? But you're 100% right. It's coming that we need to come up with some kind of game plan.
I think the biggest hurdle is for the selectman or town manager, where you draw the line. I think the Board of Health's easy if, you know, we can just pick some numbers. If the state allows 22, we can just say, we want to be conservative and say 15 max. Or whatever the number is. Right, whatever the number is, we say 15 and it needs to be cleaned prior to every, prior to or after every use. After every use needs to be thoroughly cleaned, max of 15. Town hall state says we have 17, we can max that at 12. That's easy. I think the Board of Health could do something like that, but I think the biggest hurdle is whether you guys decide where you draw the line and what the resources to do the cleaning.
Yeah.
I think that's where the problem is.
I think that whatever the guidelines you develop as a board of health will help to kind of trickle down to who are the people that are going to want to be limit the volume. If we perhaps restrict food, food at all, that also puts some restrictions on who's going to want to use it.
No, it's a good point.
So I think that we're kind of working with the statute so that, the sample of people that could potentially want to use it may shrink based on what kind of requirements we put, or restrictions we put, our limitations that we put on it, and then also the cleaning part, how that's going to get paid for.
Yeah.
So I think we can most certainly help as far as setting up the structure of what the use is going to look like. And then I think that will assist the board of selectmen as far as communications.
So, this is sort of, in front of cleaning, is practice, behavior, and protection. And so how would it impact things? Obviously, everybody has to wear masks. That's a no-brainer. What if you require everybody to wear gloves? What? So that way it significantly reduces the touch surface.
Well, it does if the gloves are clean. The gloves are just a false sense of security, because you have a pair of gloves on, you sneeze in your hands and your gloves are dirty. So
Yeah.
it's just a false sense of security with gloves. That's my feeling. I don't know if the board heard that.
I agree, well, I know, I listened. And the only comment I this is false kidding. But the only other thing I also had, how many, pre-COVID, how many could that be rented out for? Do you know, Paul?
It was rented all the time. Weekends, nights.
How many people? How many people, that's,
No, I think there was, I think it was probably maybe 50 at one point, 50 max. Because I think the cost was, I think the costs affected, I think the number of people affected the cost. So then I think there was a max too for different events.
I guess that's my point, let's just say it was 75 people, I'll split the difference, one said 100, one said 50. Was worth it, but now it's not for $100, and you have to clean it. 15 people, it sound like it. The scale of the ticket.
For instance, this, prep pack, 6 adults and 6 children, basically it's for projects, where they work with their hands, they learn to do things. And, so you got 6 kids and 6 adults, 12 people, $100. That's, $8.32 a piece. Or almost $18 or almost $17 per family. So is that?
Now, were they talking to have weekly, it really doesn't matter to me. There are weekly meetings, or they have like a big
I don't know the answer to that. I don't mean overly focus on that one, because there are, I'm sure there are
issues in that.
Yeah, it's that one because I'm familiar with that one, with the numbers that he's thrown out, so.
But I think it's something we definitely need to, think about and discuss. So I don't know if the board wants to, take it upon themselves, or they want me to continue to work with Angus and Wayne. Angus involved in the logistics, because, his office that does all the permitting, and then Wayne's got to deal with the cleaning. I don't know if you guys, how you want me to handle it, but what I remember the last selectmen's meeting when it was discussed, I think it was voted on by the selectmen that Angus would meet to talk to the Board of Health, which me, to discuss who rented it and who not. So I'm not sure,
I have absolutely no problems with you addressing the issue. I mean, you talk to Angus and or Wayne, is that what you're saying?
Correct, right.
I guess just ultimately keep us CC emails and keep us before fight and stick. So CC.
Right, but you guys recognize the need that we definitely have to open it up at some point.
Absolutely. You know what, Paul? We're not here enough. And this goes with COVID. It just goes on and on. To me, every day, that's what we have you for.
Correct, but I know, but COVID is a whole different situation.
What I'm saying is, especially because of this, where less decisions are going to be made for. Just keep us involved. That's what's the word I'm looking for. CC us or something. That's it.
So my thought was to allow, the max 22, back off some, whether it's 5, whether it's a 15, whether it's 17, back off something, and then same thing with the other facilities,
Right.
just to give it a little more extra room.
I think that's a good idea.
And limitations on, the use of it, just like the state does as far as, playing instruments, dancing.
Yeah.
Music, and stuff, all those kind of things. And even self-assessments that are done before they enter buildings, that they're not. Just so that we're not, we don't self out.
Right, and what I've been doing in regards to all the food and all these other cases, even outside, is just telling them prepackaged chips, water, snacks. Because they technically need a food permit if they're gonna issue, but again, with COVID, I just been telling them prepackaged, and they're all been acceptance of it. They also, that's fine. If they want to have a gathering of 20 at the gazebo, prepackaged. So I think if that way, they could still have prepackaged food and drinks, but just prepackaged, not someone making homemade cupcakes at the house and bringing them over.
Well, with that said, it sounds like you'll be able to expedite it. I'm not saying you're gonna do it tomorrow. Look at it, we keep meeting, discussing it, and you know what I mean?
Yep.
So we'll all be able to discuss it with Wayne and Angus, I think he said he had 2 plates in it.
Right. Yep.
So when I have a problem, I think you guys are gonna have the toughest job.
Yeah.
So
It's gonna be, I believe it will be on our agenda for our November 2nd meeting. So, that's 2 weeks from yesterday, so
It's reasonable. You all think that we can probably,
Yeah, that's not, like I said, it's, I mean, the biggest thing is gonna be on, I've already talked to Angus about it, and Rick, it's gonna be on their lap as to where do you draw the line. As soon as you open that, make that line, someone's gonna be over it, and then someone's gonna say, well, I should be there too. Because right now, the line's easy, no indoor, that's, so that's an easy line, but then you're gonna draw it, it's gonna, that line's not gonna be a straight in.
tonight, if I said you couldn't use town hall. Right? I'd be the biggest hypocrite else. Here we are. But I enjoy face to face. No offense, guys, I didn't want to spend this much time with you tonight, but I enjoy the face to face interaction.
Feelings mutual.
Okay.
Well, I call the meeting to close, Bob, make a motion, man.
If everything's all set, then I'll make a motion to adjourn.
Second of all.
Thank you, folks.
Hold on.
Thank you, Rick.
Yeah, thank you for the time, actually.
What?
Can you shut the window for me?
These are all your abstracts. Table.